Rural Americans deserve access to the best of what our nation has to offer, especially healthcare. Across every state and every community, America's rural hospitals are the first line of defense, protecting our families, neighbors, and loved ones. No matter where you live, hospital care doesn't clock out. They're there 24 hours a day, 7 days a week, 365 days a year. Each year, America's over 5,000 hospitals care for millions of patients, providing 24/7 emergency care, delivering babies, cancer treatments, and other life-saving care that patients rely on. Behind every one of those patients are doctors, nurses, and caregivers working tirelessly to keep people healthy and safe. Hospitals are our community's lifelines. They employ our neighbors and keep our families healthy. But now, some in Congress are threatening access to care. Tell Congress, protect patient care to keep America strong. Don't cut rural health care.
LifeLock, how can I help?
The IRS said I filed my return,
but I haven't.
1 in 4 tax-paying Americans has paid the price of identity fraud.
What do I do?
My refund, though.
I'm freaking out.
Don't worry, I can fix this.
LifeLock fixes identity theft guaranteed and gets your money back with up to $3 million in coverage.
I'm so relieved.
No problem. I'll be with you every step of the way.
1 in 4 was a fraud-paying American. Not anymore. Save up to 40% your first year. Visit LifeLock.com/podcast. Terms apply.
Sunday morning. With us today is Dr. Peter Michalos. Well, and his nickname, Live Long and Prosper, because he makes sure that if you follow some of his suggestions, that you may live longer. Dr. Peter Michalos, Sunday morning, what do you have on your mind?
Well, today, like we always do, we try to give information that people can go and take to their doctors and discuss them, but to give them hints on how to protect themselves. And today, one of the most important things in our life is the ability to see. And when they surveyed people, would you rather, if you had a choice between cancer and losing your eyesight, people would rather have cancer than going blind, interestingly enough. So vision is very important. And the vision, you can get several conditions that can affect vision. And one of them is cataracts. And cataracts are aggravated by ultraviolet radiation, spending too much time in the sun, not wearing protective UVA, UVB sunglasses. Very important to wear hats with a brim because a lot of the sunlight and energy comes in through the sides. And then the other thing that affects cataracts is steroids, like a lot of these over-the-counter nasal puff things that people take. It can do two things. It can accelerate cataracts. Even some of the asthma sprays that have steroids in it can accelerate cataracts. And a lot of oral steroids that sometimes you have to take, even in an emergency, will accelerate cataracts. And a certain percentage of the population, eye pressure is also elevated by exposure to steroids like prednisone. So it has to be done under the supervision of a doctor and check your eyes always. The other thing that can affect the back of the eye is macular degeneration. And that's a degenerative condition in the back of the eye where basically the garbage disposal system that cleans up all the waste products and the blood flow in your maculas, where your best central vision is, that gets affected. And we now know that eating a healthy diet with green leafy vegetables and having things like lutein and vitamin A and vitamin C all help with the back of the eye. There's even a study called the ARID study where they gave this ARID formula that contains some of these flavonoids in them that are similar to the retinal pigments in the back of the eye, and people actually got better in the study, and that's why many doctors recommend these eye vitamins that say ARID's formula on them. The other thing that can happen is elevated eye pressure and glaucoma. That's why it's very important. As we get older, it's good to get a baseline, even when you're a young person. When you get your first eye exam, and probably in your 30s, they start checking eye pressure, because elevated eye pressure squeezes and pushes on the nerve in the back of the eye. And the eye is the window to systemic disease, and many times ophthalmologists are the first to diagnose diabetes and high blood pressure, because the only place in the human body you can directly visualize blood vessels is in the back of the eye. So when the ophthalmologist sees narrowing of the vessels, because when your blood pressure's up, the vessels say, I can't take it anymore. So ophthalmologists will sometimes tell you, go get your eyes checked, and if they're really super narrow, they'll even tell you to go get your heart checked, because if your vessels are very narrow in the back of your eye, it can also be in the heart. In addition to something called diabetic retinopathy, where people, when they have diabetes, they get leakage of the blood vessels and hemorrhage in the back of the eye. And sometimes you have to spot weld it with laser to stop the bleeding and the hemorrhage. And that was first done in 1938 on a rooftop in Germany when a doctor named Michalos took a diabetic lady up to the roof, put liquid cocaine in her eye, dilated the pupil, and used a magnifying glass to actually spot weld the retina. And that was the birth of laser. And that's also a fascinating topic. So protecting the eyes, and also kids can sometimes have unequal eyes, so it's important to get eye exams on young children because one eye may be fine, the other one may be lazy, and sometimes you need to get corrective glasses or even do eye patching to strengthen the other eye and make it stronger. And there's another thing called strabismus, so we call cross-eyed or squint, and there are surgical procedures that can straighten the eyes out with amazing, wonderful technology that exists. And of course, the lens implants and small incision cataract surgery were changed forever. It used to be a large incision. Now it's a tiny, small incision, thanks to a fellow from Brooklyn named Charles Kellman, who was having his teeth cleaned with ultrasound, and they were removing plaque from his teeth. And he said, I'm going to make a little probe with ultrasound and vacuum cataracts out. And that revolutionized medicine. And lens implants were developed because in World War II, Sir Harold Ridley saw some pilots who were shot out on the airplanes, and the polycarbonate from the windshield went into the eyes of these pilots, and the bodies weren't rejecting it. And he says, wow, this is amazing. I'm going to make little tiny lenses to replace cataracts, and that was the birth of lens implants for cataract surgery. So it's really an amazing history, and the eyes are very important. So very important to get annual eye exams to check your eye pressure, your macula, your vision, and keep your eyes healthy so you can continue to live long and prosper, because if people can't see, they're at high risk for falls, car accidents, and that's why it's so important to have good vision. That's why the motor vehicles requires us to have a minimum of 20/40 in at least one eye to be able to operate a motor vehicle.
Dr. Peter Michalos, thank you so much for the update, and live long and prosper, and we'll catch up again real soon.
Thank you, John, for always getting the truth out on the Cats Roundtable.
Rural Americans deserve access to the best of what our country has to offer, especially health care. Across every state, every community, America's rural hospitals are the first line of defense, protecting our families, neighbors, and loved ones. No matter where you live, hospital care doesn't clock out. They're there 24 hours a day, 7 days a week, 365 days a year. Each year, America's over 5,000 hospitals care for millions of patients, providing 24/7 emergency care, delivering babies, cancer treatments, and other life-saving care that patients rely on. Behind every one of those patients are doctors, nurses, and caregivers working tirelessly to keep people healthy and safe. Hospitals are our community's lifelines. They employ our neighbors and keep our families healthy. But now, some in Congress are threatening access to care. Tell Congress, protect patient care to keep America strong. Don't cut rural health care.